Hello, today we're going to talk about substance use and addictive disorders. If you have ever known anyone who suffered from an alcohol or other drug abuse problem, you can appreciate how out of control that person's life became. When we see someone suffering from an addiction problem, it could be easy for us to judge that person and think something like, if only they had more willpower. They must be weak. Can't they see what they're doing to themselves and others and just quit? I suppose it's only natural that we might think about someone with an addiction problem in that way. Yet, I hope that one thing that comes out of your study of alcohol, drug, and other substance use problems in this chapter of Comer, that you will have a better understanding of what occurs in the mind, in the brain of someone who suffers from an addiction. And I hope that we will all come out of this discussion and reading, study of this topic with greater compassion for those who suffer from addiction. One observation that we will be making through our discussion is that addiction actually changes the way our brain works in ways that result in the addicted person being in a situation where they really are out of control in their lives, and the addiction has taken over. As you are probably aware, when someone experiences a substance use problem, their use of the substance, whatever it happens to be, often increases and the person experiences increasing problems in one or more areas of their life because of their substance use. Yet they aren't able to cut back or stop, and often they are not able to look at themselves in their life in a realistic and honest way because of how the addiction ends up affecting the way their brain works and how they think about themselves and their situation. That is not to say that an addicted person is not responsible for the choices they make, because they are. Yet once the addiction takes over, the person has lost the ability to make good choices in the way that you or I hopefully can every day of our lives. Fortunately, help is available, and people who are addicted can get to a better place where they are able to begin to make better choices again and hopefully live out a life that's not ravaged by addiction. As you probably know, one of the early symptoms that might be observed in someone who's developing a substance use problem is tolerance. Tolerance simply means that the individual needs more and more of the drug, whether it be alcohol or some other drug, in order to produce the desired effect. Let's say someone drinks alcohol, and in the beginning they only needed one can of beer or a glass of wine to produce the desired effect, but after a while they now need 3, 4, 5, or 6 cans of beer to produce the effect they're looking for. That person has experienced increased tolerance. Another concerning symptom is when the individual goes through withdrawal symptoms when they don't have access to the drug. These symptoms, both psychological and physical in nature, can be extremely uncomfortable for the individual and increases their motivation to seek out that drug, to take it in order to relieve their withdrawal symptoms. One way of thinking about addiction is to think about the different categories of drugs of abuse and the drugs that reside within each one of those categories. As we look at these categories, one important point I'd like for you to keep in mind is that the way drugs, including alcohol, exert their effect on our brain and our psychological functioning is by altering the activity of different neurotransmitters. And different drugs affect different neurotransmitters. The categories of drugs that we're going to be talking about are depressants, stimulants, and hallucinogens. The depressant drugs include both alcohol, barbiturates, and benzodiazepines, which are anti-anxiety drugs, as well as opiates. We're all fairly familiar with alcohol since it's widely used. And you may know of someone who's experienced a problem with alcohol abuse and have an appreciation for how too much drinking can affect the person and those around them. But you might wonder, well, how much is too much drinking? And, that's, I guess, depends on the person and how they are affected when they drink. But an effort has been made to define binge drinking, which is a serious problem among college students, by the way. And binge drinking is when a male drinks 5 drinks in succession, cans of beer, glasses of wine, shots of whiskey, whatever it might be, and when women have 4 drinks in succession. Of course, for women, it doesn't take as much because their bodies tend to be smaller and alcohol affects them more quickly. So alcohol affects the neurotransmitter GABA. That name may be familiar with you because we've talked about it already as a neurotransmitter that's associated with anxiety disorders, at least generalized anxiety disorder, where it is in under supply. So when we drink, alcohol passes through our blood-brain barrier and binds directly with GABA neurons, with the receptor sites on GABA neurons in our brain, having a relaxing effect on our nervous system. Well, some people might say, isn't alcohol a stimulant? Because when I have a little bit to drink, I'll become the life of the party. Let me ask you, could you explain that? Why would somebody possibly become the life of the party when they've had a little bit to drink if alcohol is a depressant? If your thinking is because it relaxes them some, takes the edge off, and makes them less inhibited, you would be correct on that. Unfortunately, if that same person continues to drink, eventually they're probably going to become obnoxious to people in the party. They may say and do things that they later regret, and their drinking may end up causing some pretty serious problems for them. Another category of antidepressants is the barbiturate drugs. Barbiturate drugs also involve the neurotransmitter GABA in the same way as alcohol. Barbiturate drugs are not prescribed all that much anymore, but in the 50s, 60s, around in there, they were prescribed a lot for anxiety and insomnia. They were found to be highly addictive and also quite lethal when taken as an overdose. The next category of depressant drugs is the benzodiazepines or anxiolytic drugs. This would include drugs like Ativan, Xanax, Valium. These drugs also affect GABA activity in the brain in the same way as alcohol and barbiturates, and are prescribed nowadays to help people with anxiety and also insomnia. They too are subject to addiction, therefore need to be closely monitored when someone is taking them. And finally, we have the opiates, which include heroin, morphine, the prescribed pain medications like Oxycontin and various other hydrocodone, various other uh, opiate derivative drugs. So in the case of the opiates, the neurotransmitter that is involved is endorphin. Endorphins are neurotransmitters that have an analgesic effect. Whenever we have an injury to our body, when the pain sensations register in our brain, then neurotransmitter endorphin increases and helps to ease the pain. Of course, drugs like morphine have legitimate medical uses in helping patients who are suffering from a high level of pain, say from an injury or cancer or something like that. As you are probably aware, there is an epidemic of opioid abuse going on around our country right now, and many people are dying from heroin and other opioid overdoses. We will return later to a discussion about a drug that is used to help save the lives of individuals who have overdosed on opioid drugs. The next category of drugs is the stimulants. The stimulants include amphetamine, methamphetamine, cocaine, nicotine, caffeine. We're going to focus mainly on amphetamine, methamphetamine, and cocaine. All three of these drugs affect dopamine activity in the brain, in the brain's reward pleasure centers. When you or I experience a pleasurable event, we are likely to experience an increase in dopamine activity in our brain's reward pleasure centers, in the vicinity of where our hypothalamus is located. When someone abuses stimulant drugs, there's a tremendous increase in the output of dopamine from the dopamine neurons in the individual's brain, to where they eventually have to come to rely on the drug in order to experience pleasure because their dopamine neurons become depleted. This drives the cycle of addiction for these individuals because they need the drug in order to experience that high. And over time, they're not able to experience pleasure so much under normal circumstances. So they need more and more of the drug. And when they don't have the drug, they may, to use the street term, crash, where they become very depressed and may experience withdrawal symptoms and then have to have the drug to pick themselves back up. It's a never-ending cycle that just gets worse over time. One of the ways in which we can understand this cycle is by thinking about it from a behavioral perspective, in addition to the biological perspective we've already considered. Remember that operant conditioning, which is a behavioral type of learning, involves positive and negative reinforcement. So when someone uses a stimulant drug, they feel a rush of pleasure, which is reinforcing in a positive way, or rewarding if you would like to use that word. But then when the drug wears off, they feel very bad and have to have more of the drug to pick themselves back up, and probably have to have increasingly higher doses of the drug. So the addiction begins with positive reinforcement and then continues with negative reinforcement, where something unpleasant is happening. The person is experiencing withdrawal symptoms for not being on the drug, and then they need to take more of the drug to ease those symptoms and to experience pleasure again. So you can see how the cycle of addiction can really take control over the person's life. Classical conditioning is another type of conditioning that can be associated with drug abuse also, because people who have used drugs tend to associate their drug use with different environments, conditions, stimulus conditions, if you will. And when they are in those situations, it actually triggers the release of dopamine in their brain and reinforces the conditioning that has taken place to where they crave the drug even more strongly. The third category of drugs of abuse that I'd like to speak about briefly is the hallucinogens. These are drugs that actually can produce hallucinatory experiences, having unusual thoughts, feelings, seeing or hearing things. That's how they get their name, of course. And a commonly known drug in this category is LSD. Marijuana is also categorized as a hallucinogen drug. And of course, there's a lot of controversy surrounding marijuana and its use, with it becoming recreationally legalized in increasing numbers of states now, and medically legalized in even more states. So that's a little bit of an overview of the main categories of drugs of abuse. And I'd like to talk with you now a little bit about approaches to treatment. Let me say that there's a fair amount of controversy surrounding the treatment of alcohol and drug abuse. Some people believe that it might be possible to help some individuals to learn how to use their drug with moderation, but still use it, whether it's alcohol or some other drug. And there are others who believe the risks are too great to try to help someone achieve that goal, and that abstinence is a more sensible goal to help people to work towards achieving who have a problem with addiction. So I hope you'll think about this controversy as you're reading about approaches to treatment in your textbook and see what your thoughts are on this topic. I would like to talk a little bit about three approaches to treating substance use problems: biological, cognitive behavioral, and also AA and similar programs. There are some drugs that are sometimes used in the treatment of addiction problems. Some of the drugs will cause the person to feel sick if they take the drug. And then other drugs that are used will try to block the effects of the drug so that it doesn't really produce the desired effect in the individual, therefore decreasing the likelihood that they will use it. An example of a drug that will make a person sick if they use the drug is antabuse, that's sometimes used in the treatment of alcoholism. And an example of a drug that's used to block the effects of an abused drug would be naloxone. Also, I think goes by the name of Narcan. And this is a drug that's sometimes used to help rather dramatically reduce the effects of an opioid overdose in an effort to save the life of the person who's used the drug, the opioid drug, heroin or some other drug. You may well have heard of this drug in the news, or if some of you work in healthcare settings or law enforcement settings, you may have some firsthand experience with the use of that drug to save lives. A popular approach to helping people with addiction problems is the use of cognitive behavioral therapy with an emphasis on relapse prevention. With this particular approach, individuals are helped to identify triggers that place them at risk for abusing substances, and then learn and practice strategies to help deal with these triggers more effectively. For example, if someone is more likely to turn to the drug when they are stressed out or feeling upset or very fatigued around certain people in certain environments, they receive practice in learning how to learn alternatives to dealing with those situations and avoiding them where they can, so that they might be less likely to turn to an abused drug at a time like that. 12-step programs like Alcoholics Anonymous have been around for a number of years and have helped many, countless thousands of people with addiction. You may have some familiarity with Alcoholics Anonymous, Narcotics Anonymous, Al-Anon for family members, and Alateen for kids that live in families where alcoholism is present. Most communities have chapters of AA and NA in them and have regular meetings that people can attend. These programs are based on a 12-step recovery model that is spiritual in nature and oftentimes is a component of treatment programs in inpatient and outpatient settings. I've included with your study materials for this unit video featuring Nora Volko, who is a world-renowned authority on addiction. I look forward to you having the opportunity to hear her talk. I really like her ideas on this topic, and she's involved in very exciting research and has been for a number of years in trying to help us all to better understand addiction and how to help those people who are suffering from the throes of addiction. I hope you'll feel free to share some of your comments about her talk in your discussion board forum. Well, I guess that's it for now. I look forward to talking with you again soon.